this is our proud to start or launch this society on the day when it is World Radiotherapy Awareness Day. So we are very happy to be launching on the same day as the World Radiotherapy Awareness is celebrated in the world. So thank you everyone to join us today and to be part of this journey. So I will go a few slides about why Amstro, what is the purpose of Amstro? Sorry. So the reason for Amstro is there are gaps in access and in the workforce, and also the acuity in our region. So patients in the region lack the timely and quality radiotherapy access. Also, there is a severe workforce shortage of oncologists, medical physicists, radiation therapists, and other allied group working with us. There is also equity gaps. There's rural versus urban access to radiotherapy care. Also, there's a high income versus low income countries in our region. So the purpose of this is to building a regional voice for all of us. So as mentioned, that building a regional voice from Asia to Middle East, there is no single platform we know of currently which unifies AMTRO and Asia professionals together. Amstro also provides a collective voice in advocacy, education, and policy and global organizations. So again, for the why Amstro, our promise. So we promise delivering the solutions through collaborations. This is the key. We share knowledge across the border. We will train the mentor and the next generation. We'll lead the regional research and guidelines, strengthen the systems for equity and quality. So what we promise is that together we can transform cancer care in our region. From here, I want to introduce the board members of Amstro. So first, I would like to introduce Dr. Hussein Al-Kushi as the president of Amstro. Dr. Al-Kushi, if you can unmute and talk about you briefly.
Assalamu alaikum, everybody. Welcome, dear colleagues and oncology professionals. I'm pleased to be a master president. And the reason that we choose this is it's creating a platform that helping to uniting all oncology experts through our region, that helping to improve cancer care in our region. Thank you and welcome.
Thank you very much, Dr. Hussein. I would move on to our Amstro Vice President, Professor Saiful Haq. I hope he have enough good access to talk to us today. Otherwise, we have the video to play on his behalf. So, Prof. Saiful Haq, are you there? If you can unmute and talk to us.
Thank you, Dr. Nadeem. And I hope you can hear me. Can you?
Yes, we can hear you.
That's good. So hope the internet connection will be okay. As Dr. Nadeem said, my name is Saiful Haq. I'm a medical physicist at UPMC Hillman Cancer Center in Pittsburgh, Pennsylvania. And I'm also Vice President of Amstro. I would like to take this opportunity to read the mission and vision of Amstro so that you all know as to what the mission or vision of the society is, even though Dr. Nadeem has given you a brief perspective. The mission is to advance equitable, multidisciplinary, evidence-based, high-quality cancer care across Asia and the Middle East by strengthening therapeutic radiation oncology through education, research, clinical excellence, and health system innovation, and empowers professionals to transform cancer care for all. And the vision of Amstro is to shape a future where resilience and patient-centered cancer care thrives across Asia and the Middle East, guided by innovation, regional leadership, and global collaboration. And if you ask why I joined Amstro, you see it on the screen. So I believe cancer care is a truly global challenge, and solutions must be shaped by voices from every region. And I personally have seen how strong professional societies can transform practice and policy. It's really a unique opportunity to contribute my experience in medical physics and global oncology to help build a regional platform that strengthens collaboration, education, and innovation. But it's not a one-way exchange only. For me, Amstro is also about learning from colleagues in the region. And why is Amstro important for the region? There are many reasons. I just say a couple of words about it. Amstro is important because it creates something that has been missing, a unified voice for Asia and the Middle East. It brings together diverse professionals across countries to share knowledge, harmonize standards, and advocate collectively. Most importantly, it ensures that regional priorities are not just heard, but led the way in shaping equitable and high-quality cancer care. It's really a privilege and honor to join this Amstro leadership and the Amstro Society, the organization. Thank you, Dr. Nadeem.
Thank you very much, Prof. Saiful. Thank you for making effort to join us, even though you're on the boat with very limited internet access. I appreciate that. So we go to the next slide, and having some problem in moving the slide. So the next is that I already introduced myself, that I'm Nadeem Pervez. I'm a radiation oncologist and currently based in Abu Dhabi and UAE. And my interest area are prostate and breast cancer, with mostly focused on the prostate brachytherapy, which I introduced in the Middle East. With this, I would like to talk about the program and the pillars. So our programs and pillars are regional collaborations, education and capacity building, equity in cancer care, research and innovation, and leadership and governance. With this, we have Amstro have major goals, and the 5 major goals are displayed in here. So with this, we want to build the collaboration, innovation, and advocacy. We want to strengthen the oncology education and workforce capacity, ensure equitable, high quality, and patient-centered cancer care across Asia and Middle East. We want to foster innovation and elevate regional research in radiation oncology. We also want to strengthen leadership and governance for sustainable cancer care. So these are 5 major goals. There are many sub-goals, which for the sake of time, I did not put the slides in here, but you can find them on the website later on. With this, I will move on to our next board member, which is Dr. Abdulaziz Al-Ghamdi. And Dr. Abdulaziz Al-Ghamdi, if you can please unmute yourself and introduce yourself.
Assalamu alaikum and hi everyone. My name is Abdulaziz Al-Ghamdi. I'm a pediatric radiation oncologist based out of Riyadh. The reason why I joined Amstro as a board member is because I believe in collaboration in oncology. I think as we do in the clinic, it's a multidisciplinary effort. I think at the level of providing care, we have to engage everyone. What I believe that Amstro can do to the region is actually engage with everyone. I understand that we have built amazing national societies across Asia and the Middle East. I think next step is to find a way where all of these societies, all the healthcare workers, they can engage to address our local issues. I think we have very particular questions in our part of the world. And the only way to address this is through collaboration. We have one of the fastest growing regions in the world. We have also increased demand on health services at unprecedented rate. And I think collaboration is the way to go forward. I think we have a great panel and participants from across the board. Thank you so much.
Thank you very much, Dr. Abdulaziz Al-Ghamdi. We will move to our next board member, which is Dr. Thuraya Al-Hajri. Dr. Thuraya, if you don't mind unmuting yourself and talk about yourself.
Hello, assalamu alaikum, and good afternoon, everybody. My name is Thuraya Al-Hajri. I am a radiation oncologist at the National Oncology Center in Muscat, Oman. I have interest mainly in breast radiation and SPRT. And I had the honor to join the Amstro team, mainly to be part of this diverse group of professionals, mainly to share the experience, knowledge, and improve the standards of care. Now, Amstro is very important for us in the region, and that's because, as you know, Asia and the Middle East, they are facing lots of challenges with the growing number of cancer cases, for which we want to collaborate through the countries and the members of Amstro to improve mainly the cancer treatment and also to improve the outcome in these countries.
Thank you, Dr.
Thank you,
Thuraiya, for summarizing. Yes, thank you. Welcome. Our next board member is Dr. Isa Muhammad. Dr. Isa Muhammad, if you please introduce yourself.
Thank you, Nadim. I'm Dr. Isa Muhammad, a consultant radiation oncologist at King Hussein Cancer Center in Amman, Jordan. I am specialized in head and neck cancer and GI malignancies. I am leading the head and neck multidisciplinary team, and I am the Radiation Oncology Fellowship Program Director. I'm doing a lot of research work, and my research is well aligned with my clinical duties. So I believe that cancer care across Asia and the Middle East is very uneven. Some centers have cutting-edge technology, while others still struggle with access. They have shortage with education, training, and research. I believe that Amstro helps bridge this gap by connecting experts, providing training and education, and advocating with policymakers to make radiotherapy a priority access. So we need to work together with our region, with our colleagues, to foster education, research, and collaboration. And this can be done, I think, through Amstro. Thank you, Nadim.
Thank you very much, Dr. Isa Muhammad. We will move forward. And Dr. Laith Mullah Hussain, if you are here, please unmute and introduce yourself.
Assalamu alaikum, brothers and sisters in this platform. I'm Laith Mullah Hussain, a radiation oncologist based in BC, University of British Columbia, and BC Cancer Center for the North. It's 5:20 now in AM in my time. I'm happy to be part of the Amstro. I think that Amstro hopefully will cover the efforts from Asia and Middle East, which is maybe the largest population in the world. And we need to unify our educational programs. We need to improve them. We need to collaborate. We need to improve the research caliber in our region. We need, at the end, we need to improve the care in our region. So I think Amstro will gather the efforts of the radiation oncologists and medical physicists and radiotherapists across the region, and hopefully we'll achieve our goals. Thank you for this opportunity, and I'm looking forward to see you all in the first annual meeting that will be done in February 2026.
Thank you, Dr. Laith, for doing all the effort. And we always find you, even it is early in the morning or middle of night, that you attend the meetings. Thanks again. So with this, when we have the, about Amstro, about board members and what is next. So the next is we are working on currently now to make council and committees. We have, you can see the list of council and committees to save your time, to give you interaction time. I would not name all of them, but it's displayed on the screen. Also, it is available on the website. And we are in the process of forming the Medical Physics Council with Dr. Ghada Al-Dosri and Ms. Iqbal Al-Amri are leading that effort. But there are other options where people can join us. So I would recommend everybody to be part of this journey together. If you are passionate about education and mentorship, please apply our Education Council. If you want to shape the cancer policy in your country, join our Advocacy Committee. And if you are looking for research, you can join our research network where you can bring your own concepts, or you can join already ongoing research. This is all under process of building those committees. Also, all of us can be the part of AMSTRO by being member. Member have many facilities, and for the membership, you can go to this website, which is listed here. And with this website, you can submit your application with your information to become a member. This is open now on the website. You have to just type the all correct website address. You can find yourself there and you can submit your application. Being board member is it's free to the benefits which AMSTRO will provide to its member. Also, anyone who want to contact us, there are multiple ways to contact. It can be a form, which is on the website, listed on the website. We have an email address. We have a WhatsApp number or contact number, not for receiving phone call, but messages can be sent out. And we have mailing address based in Sharjah through S2. So what is other next is that we are working on AMSTRO 2026 annual conference. This will be 6th to 8th February 2026 in Dubai. This is just before Arab Health, and if people are traveling Arab Health, they can always come 3 days before and join this meeting. So if you want to register for this conference, you can also use the website and register for free. And we will be bringing all the leaders in the world in this meeting to exchange the knowledge with all the attendees. This will be virtual actually and in person. We encourage people to attend the in-person. However, virtual option will be there for people if they cannot travel. With this, I want to acknowledge, and my acknowledgement will go to first the concept of AMSTRO. This webinar launching will come from Dr. WRAD Al-Dosri. She's a medical physicist based in Riyadh, and she will be leading the physics formation of the council. Also, Ms. Iqbal Al-Amri, who was helping for the webinar. She's a medical physicist in Muscat, Oman, Sultan Qaboos Center, and she is also helping. So Dr. Ghada and Ms. Iqbal are forming medical physics, and whoever have interest to join Medical Physics Council can contact them. There's another acknowledgement. Actually, we are affiliated with Arab Science and Technology Foundation. We thank them, especially the president, honorary president, His Highness Sheikh Dr. Sultan Al Qasimi, member of Supreme Council and ruler of Sharjah, and their support is highly appreciated. Without them, we cannot reach to this far. I would also like to say a word about Dr. Ikram Birni, who suggested this name. I know he's attending the meeting, so thank you, Dr. Ikram. With this, thank you. I would like to open the forum for question and answer, and Dr. Ghada Al-Dosri will be taking that lead.
Thank you very much for introducing this important initiative. We hope this answered some of the preliminary questions, but if you have any more questions, we do have some time. I see somebody already posted a question about radiation therapists. Will there be any council for radiation therapists?
So if you may allow, I can answer that. Yes. So we are making the council for the radiation therapists as well. And it will be the physics council will lead the initiative. And the radiation therapists can contact Dr. Ghada, Dr. Iqbal, and also Ms. Zahida Mullah. They will be leading this effort to create a radiation therapy council.
Very good. We will be working with this. Ms. Zahida, I believe, is online with us as well. As you know from previous conferences and events, she's been very active, but we're very lucky to be able to work with her and her team. We have another question. Somebody was asking, Radwa is asking if they'll be able to collect data from our region and make guidelines.
Okay, so if anyone else want to take lead, no problem, I can answer that. Yes, our plans are to create the guidelines for specific to our region. It will be according to standards of international, but tailored to our region. There were some work was was initiated already. I can give one example. Dr. Isa Muhammad was working on creating a guideline for Amstro. But our efforts, yes, as we mentioned, these are our goals that we are going to create our guidelines. Thank you.
If I may jump in, this is Saiful Haq again. I assume, I'm not quite sure what you mean by guideline. There are all kinds of guidelines that one can gather data for. But maybe for my clarity, assuming that you are thinking of guideline-based treatment, or say, for example, if you want to treat prostate patients of a certain staging and stuff, how do we treat those patients? If that's what you are thinking, absolutely, we would welcome participation from everybody in this effort, because this is an initiative by everybody for everybody in the region. So if you have ideas, please share with us. This is our launching ceremony here, and we would welcome any ideas that you have and whatever guideline you are interested in, and we'll work with everybody to form the appropriate groups, really, to make sure that we address all the challenges and opportunities that are out there. But absolutely, thank you, Dr. Nadeem, for also answering that question.
Thank you. So back to you, Ms. Ghada.
Thank you very much. So we have a few other questions. If Professor Hanan Malkawi can unmute and ask her questions, please.
Yes, please. I was, in fact, first of all, I'm the Professor Hanan Malkawi from Yarmouk University, Jordan, and I'm the Vice President of ASTIF. In fact, I would like really first to hear some words before I step in with my questions from the President of ASTIF, if he's with us, Dr. Abdullah Najjar, because without him, I think we will not have this initiative going. So if you allow me, Dr. Nadeem, if Prof. Abdullah, Dr. Abdullah Najjar is here, I would like him to say a few words, and then I will throw my few questions.
Yes, please, Dr. Abdullah Najjar, if you can unmute yourself and can ask or say a few words.
Dr. Hanan, please go ahead. You do it, because I'm not in a situation where I can take my time and talk. So go ahead, Dr. Hanan. Shukran lak. Thank you very much.
Okay. In fact, I have just a few questions. One of them is if you could shed light about how does the advisory committee, if there is such a committee of regional leaders in the region that could influence the executive committee decision. This is one question. The other question has to do with sustainability, in fact, and engagement. Like, how does Amstro plan to keep members active and committed beyond, courses and annual meetings or conferences? And the third question is about evaluation and impact measurement. Like, how could we specify the progress and success measured with certain indicators about, how Amstro could use and evaluate its regional impact? Thank you.
Thank you, Professor Hanan. Okay, may I ask Professor Saiful Haq, our Vice President, to answer this question?
Sure. Thank you, Dr. Nadeem, and thank you, Professor Hanan, for asking those questions. I will take from the last one first, and then I'll go backwards. You ask a very important question. How are we going to evaluate ourselves? How we're making progress and what kind of progress are we making? I'm pretty sure, and you'll be coming to the Dubai meeting. We already have developed a program, and at the Dubai meeting, we'll have a Dubai declaration. And at that meeting, and we are actually working on the various, if you will, the metric. There are 5 different goals we have, and we are right now creating the metric in terms of how we will measure our progress, in what will we accomplish in 3 years, in 5 years. So there will be a declaration of that. That will be the Amstro promise to our all the members and all the societies that will become part of Amstro. So I'll ask you to bear with us. And when you attend the Dubai meeting, you'll see that we call that Dubai Declaration. Okay.
Sure.
So you'll see all the details there, and it will take some time. And
That's great.
we'll certainly reach out to everybody, for your support. And because we can say many things that we'll do, but we will not be able to do anything unless we have collaboration from everyone. We welcome everybody's participation. This is a society for everyone, and to make a difference in the region. So we will learn from everyone, we'll contribute, we'll be the hub, we'll be the society that will actually bring the entire world together. That is how we see this society to be. We'll contribute towards the world, and we'll learn from different societies from the world. It's a give and take process. And keeping all of those ideas in the back of our mind, we will create that Dubai Declaration. We'll reach out to you to see whether you have any suggestions as to how you and other ASTIF and other members see that we should include in our Dubai Declaration. So
Yeah.
that hopefully answers your third question. And you'll have to help me out with the first and second question. The second question, I
About
think
the
was the question-
sustainability and engagement.
Sustainability. Yes, this is again a very important question. So many societies thrive on the commitment from their members. That I live in the US, I'm a member, and I've been in the leadership role of the American Association of Physicists in Medicine. That society is pretty much run by the commitment from all the members. Gad Al-Dosari, Dr. Al-Dosari is here, and also Dr. Iqbal. They're also members. And I've given 30 years of my life really towards the voluntary service to AAPM. We'll be welcoming colleagues from around the region to be volunteer members. Similarly, the leadership also. We have to look end to end. So there'll be an important source. And yes, there needs to be financial, the resources that need to be there. So we'll be looking for resources. This is this society is just being born, right? It has just been born. So we'll be looking at financial resources from different organizations, the manufacturers, and in the region, even though you hear that it's a radiation oncology, but this is a society where there's a space for everyone. There's a space for medical oncologists, surgical oncologists. Everybody will, everybody will be at the table. And in our Dubai meeting, you will see we are actually planning to invite, and in the process of doing this, inviting leadership of all different kinds, leadership from all the industries, leadership from radiation oncologists, societies, medical oncology society, surgical oncology society, leadership from the healthcare infrastructures, leadership from the NGOs, from government. So we will be really, when we say that we are the hub for everything, so we will really be working with everybody. And every resource that we can get, we'll approach, we'll knock at those. We'll also be working on, the writing grants, for scientific purpose, research and innovation, right? Industry and government grants. So we'll be working with different funding agencies also to try to develop grants. So, when you start to make a difference, you'll see that everybody will want to be part of a society which is making a difference. And then the sustainability, I'm really not concerned. And none of us in the board members, none of us are concerned about it. And also the support of ASTIF, Dr. Nadeem has already expressed gratitude, and without your support, we'll not be here today. And you see, you've already provided support, and And we have already gotten support, word of encouragement in terms of financial support from different vendor organizations.
Yeah.
So that's the sustainability. And help me out, please, with the last question.
Yeah, in fact, the first question was about, involving decision makers with your councils and, committees and all of that. And also, as you mentioned, I mean, it doesn't have to be all for physicians or MDs, because, there are no borders between sciences nowadays. For example, I'm in biotechnology, and I use nanotech for some medical, applications. So, I mean, that might also serve a good aspect for sustainability and evaluation if you involve so many disciplines, in fact, not just MDs,
And we are an open society.
Yeah.
Everybody is welcome within the society. And as you said, there are no borders.
Mhm.
When we, patients are in our forefront. We are all here because we care for the patient, right? And in order to treat this a given patient, we'll go anywhere and everywhere. There'll be no borders. There will be, and it's the cross-border collaboration. Collaboration is the key. It's the collaboration that will help us to get to wherever we want to go. Sky's the limit. And we really will want everybody's support in here. Please join us.
Thank you.
Thank you.
And-
Sure.
Thank you. Thank
And
you,
we'll-
Prof. Hanan and Prof. Saiful. With this, Ghada, I go back to you for any other questions.
Thank you very much. Thanks for emphasizing the importance of collaboration and this being an organization for everybody. I'm a medical physicist. We have colleagues who are in radiation therapy, and they've already expressed their interest in forming activities related to therapists. We also have people who are in leadership and policymakers. So this is really going to be an inclusive organization for everyone. Let's switch gears a little bit. Somebody was asking about mentorship and if there'll be a structured mentorship program offered within Amstro.
So, Dr. Ghada, can you answer this one?
I think this would be the goal. So the idea is to definitely target mentorship. Ideally, within the activities that we're hosting and within the formation of councils, we will also provide opportunities for the next generation or the younger professionals to also learn and to also contribute. And we can both benefit from each other. So the mentorship program part is going to be a bit of a longer goal. So it will require some time. If we have more people who are interested in this, we can definitely set it up in a more structured way. But there will be mentorship opportunities organically within the organization.
Great. Thank you, Dr. Ghada. Can move to next question.
The next question, we did tackle this a little bit, but somebody was asking about the theme for the upcoming conference in February, inshallah, in Dubai. Is there a theme? Professor Saiful, would you like to elaborate on this? Okay, aside from mentorship, there was also a question about future plans for Amstro to have its own journal or platform for student and faculty research publications.
Yes, may I answer? Maybe I can take the answer to this question and the previous question also.
Please. Thank
Yes, we do plan to have the journal for the society. That is in our plan. We have, education, research. There's a research council is there. So yes, it's in the works. It's in our plan. And then also the prior question was, what was the theme? The theme is shaping the future of cancer care, regional voices, global collaboration. And it will be a 3-day meeting. And this meeting will be a bit different in terms of its scope compared to the traditional scientific meeting that we all are used to when you go, say, for example, an ISTRO meeting or an ASTRO meeting or a MIFOMP meeting. There when you go, you see 3 days of all different kinds of scientific meeting. But here, we'll have a meeting where, on day one, the theme for the day one is leadership, diplomacy, and regional action, where we'll be bringing together leadership from different major societies. You are inviting the president-elect of ASTRO, AAPM. ASTRO is the American Society for Therapeutic Radiation Oncology. AAPM is the American Association of Physicists in Medicine. We'll be reaching out to the president of UICC, president of ASTRO, president of the president-elect, and the president of all the different societies in the Middle East region, say the Surgical Oncology Society, Medical Oncology Society. So, so we'll be reaching out to all of them. And we'll also have sessions with the industry leaders, you know, all the radiation oncology specific, the industry leaders that are there, Varian, Electa, Accuray, you know, we'll be reaching out to all the different, the leadership. We'll have a session also on whole health. You know, when we think about treating a cancer patient, it's an end-to-end treatment. We look at the patient as the whole human being, rather than in addition to just treating a patient with all the different drugs and technology that are there. So we'll have sessions with the regional experts from different religious side, you know, looking at the human health aspect of it. We'll have sessions with the leaders from the medical oncology discipline. We'll have sessions planned for the different, like the drug company executives, if you will. So that is the theme for day one. And then there are also the artificial intelligence and what is going to come in the near future, in the years to come. Day two will be focused on health systems, science, and regional empowerment. We'll also, forgot to mention that we'll also have sessions with the different government leadership also, because they are part of the entire theme, you know, from end to end when we treat our patients in terms of improving cancer care, you know, cancer control and all of that. We'll need all of them. And day three will be capacity building, commitment, and the Amstro way forward, which is the Dubai promise that I mentioned. So I'll stop there. So that says a lot. So hopefully you all will be joining us in this exciting, a very different kind of meeting that we have planned for all of you.
We had one more question and a request, actually, which I think is very appropriate for today. So the question is about upcoming webinars and educational activities. If we have anything planned in the next while, will there be any activities in the next coming months before our conference, for example?
Yes. So the plan is actually to have regular webinars before the conference, and that would be planned and executed soon. So when you be a member, please join the membership from the website. And also you have to type the correct address from http www all full address. You'll reach to Amstro, and when you get the membership, you will be informed about the upcoming webinars.
And if I may add to what Dr. Nadeem just said also, and our plan is to really hold a webinar every other week, focusing on different items of interest, so that this will lead towards the inaugural meeting in Dubai.
Inshallah. So please sign up and stay tuned for that. We will be contacting by email to provide more announcements. And finally, before we end off, we would like to capture a photo of people who are interested. Please turn on your camera and we'll take a photo of this momentous day.
Yes, so thank you everyone to attend. And you know, this is a shared journey between us. And this is only, what I want to say is that this is only the beginning. This is only the launching of this society. We have a lot to do, but we invite all of you to join, because this is our work. This is your society. This is our society. And we all have to contribute. That our power will increase by joining hands together. So I request all of you to be part of this. Thank you very much.
See you in Dubai.
See you in Dubai.
See you. Bye-bye.
Welcome,
Thank you,
everybody.
Dr. Nadeem.
Okay, thank you very much. Dr. Ghada, you want to say anything?
Thank you, everybody.
Thanks, Dr. Nadeem and everyone.
Thank you. Thank you very much
Thank
for
you all.
attending.
Thank you to all
Thank
the
you,
team.
everyone.